And I'm Mabel, Jong. Welcome back to continuing coverage of the World Healthcare Congress, coming to you from Washington, D.C. And in our studio, Suzanne Webb joins us. She's the CEO of Exclusive Surgeries Solutions, and she is going to talk more about the centers that you see across the country that are offering surgeries at a transparent price.
Correct.
Okay, tell me about the growth of this particular segment of healthcare.
I think it's the new trend that's going to take everybody. We've got, like I said, 10,000 surgery centers. It is more affordable. These are the doctors that everybody wants to go to. Our surgeons take care of all the professional athletes nationwide. So every time you hear of a surgery or orthopedic surgeon that's done something on a professional athlete, they're doing it at ambulatory surgery centers because there's very little infection.
Okay. Are these surgeons exclusive to Exclusive Surgery Solutions, or are they affiliated with big hospitals in the area as well?
They're both. A lot of them are the independent surgeons that own their own ambulatory surgery centers. Some are part of more larger groups. They work at the hospital. Surgery centers only take care of people that are healthy. So if you have a lot of comorbidities, then you do deserve to be in a hospital setting. But those that are healthy, that don't have any comorbidities, they're perfect for ambulatory surgery centers.
Okay. What is the interest level in this particular area?
Everyone's loving it. They want to cut costs. This is the most efficient way to have surgery. We don't have the huge overhead. There aren't overnight beds. It's day surgery. You go in, you have surgery, you're going home. It's much better to recuperate and actually do physical therapy immediately and start your recovery process, where in the hospital that doesn't happen for days. And clinically, it's just better for you to start right away.
Okay. How do people hear about you?
Mostly from coming to conferences like this, really sharing with people. I've been in the medical industry since 1986, and so I've worked on the hospital side as well as the others. So all of those great connections are still there. Mm-hmm. So we're able to go to employer groups and talk to different people because, like, oh, we know who you are. We want to understand what you're doing now, and how do we get our employees to be able to have this benefit.
How do you begin to even price procedures?
The pricing part's easy. I've actually owned a revenue cycle management company in this space for 15 years. So I know all the numbers. I know what the doctors want to get paid, even out-of-network doctors, what we can negotiate and bring those great doctors to a good price point. They're saving 40 to 50% from a hospital surgery. And at the hospital, you're not getting that top-ranked surgeon because that's not where they are. They are not employees of hospitals. They own their own centers.
Okay. How are the procedures paid for? Is it covered by any type of insurance plan right now?
Most of the plans do cover it. It's just a matter of giving them the bundle ahead of time. We do the same utilization review. We do the same medical necessity. All of those regular delivery system places are all in place. We're not changing anything. We're very simple. Plug us in. We give you the price point ahead of time, and then you pay the surgeons like you would anyone else. They're getting the same medical bill. They're getting the same UB04, CMS 1500. So none of the billing process has been complicated.
Okay. If someone were to see this segment and decide, yes, this is what I want to do, what's the first step?
The first step is to go to our website, it's esurgeries.com, and actually just tell us that you're interested. We'll have someone call you back within 24 hours, find out exactly what you're looking for, if you're a broker, if you're an advisor, if you're an employer group, and you just want to add this directly, how you would actually add it in, and how many providers we have in your area.
Okay. Any other message that you'd like to leave with our viewers?
I think the most important thing is that by going to ambulatory surgery centers, we get rid of that infection rate. The infection rate at the hospitals, everyone can see it. It's now something that hospitals have to post on their website. They're just getting out of control. You can't really outwork the infection rates, and they're just expensive. Hospitals are making a lot of money on it, but it's hurting a lot of healthy people that are going for surgery. And if we can get rid of that, where we have zero infection, and get them back to work quicker, it's just better for the patient.
All right, Suzanne, very, very interesting. Thank you so much for stopping by.
Thank you.
And I'm Mabel, Jong. Stay tuned. We have a couple more interviews to go.